I appreciate someone finally walking me through the real problem instead of just recommending surgery.
Knee replacement can be an excellent operation for the right patient at the right time. When the joint is severely damaged, function is significantly limited, and appropriate non-surgical treatments have been exhausted, replacement surgery may restore mobility and quality of life. My goal is not to convince every patient to avoid surgery. My goal is to determine whether surgery is truly the right move now or whether the joint has meaningful preservation potential. For some patients, that evaluation may involve a deeper look at the supporting structures of the joint and whether joint preserving strategies may still be appropriate. In selected cases, that can include carefully targeted treatments such as platelet-based strategies or bone marrow-derived orthobiologic approaches. For others, replacement may ultimately be the most appropriate decision. What matters most is that the decision is based on complete information, careful judgment, and trust in the process. If you've been told that knee replacement may be necessary and want a more comprehensive evaluation of the joint before making that decision, that is exactly what this consultation is designed to provide. The goal is not to avoid surgery at all costs. The goal is to make the strongest and most informed decision for your joint and your long-term function.